Hello everyone. There's a question people ask now every now and then. Well, it requires a long answer. Someone texted me just on my phone asking me, is complete face transformation possible? I didn't reply because I'll quickly prepare this video and put it online. I'll send the link of the video to that friend. Now listen, is complete face transformation possible? Short answer, yes, true. There's something like this. But for whom? But for what purpose? There needs to be a logical reason to have it done. The patient needs to be suitable for that. Plus, you need to consider this. Patients generally demand this to be unrecognizable. Alright, face transformation is done not to be recognized, but you must remember this. Such surgeries are not meant to make someone more beautiful. You can make someone uglier. Sometimes you may need to make someone uglier, because the purpose is not to be recognized. This is not an aesthetics operation. It's not a beautification. Also, there are those who make silly, stupid requests. I asked the man, why do you want to have this surgery? He says, well, I'm bored with my life. Now, you cannot have a face transformation with a reason like that. Stop this nonsense. No one's asking about the cost of it all. Such surgeries are extremely costly, because there are so many operations done and it doesn't end with a single surgery. You must have a very good large budget for that. Now, I'm not going to go into details, but I have done such surgeries before. For instance, let me give you an example. One day, they brought a lady to me. A gentleman brought a lady. He said, this woman was a prostitute. I want to save her from this life. We'll get married, so we want her face to be transformed. Now I looked at her. She had a perfect face. I mean, truly, life has treated her really badly. She had transformed. She had some misfortunes, but her face is excellent. I looked, but there's nothing to do. What can I do? I'm not willing to make her ugly, I said. Honestly, I don't have much planned for this patient. But let me ask a colleague of mine, maybe he can do something. He's someone interested in this type of things. I made a call, I told him there's a such patient and I said, honestly, her face is very beautiful. I couldn't plan anything. I don't want to disturb this beauty. My colleague said he was a little hesitant also. He said, send her so I can have a look. I sent the patient. Then I heard that he had 1 or 2 minor operations, but I suppose it wasn't to transform the face as far as I understand. She had some Botox, fillers and such. Now listen, as I said, these are not operations performed to maximize the beauty. Keep that in mind. That's one. The second thing I recommend to the patients who want face transformation doing this. Go and change your hairstyle, dye your hair. If you are wearing specs, wear contact lenses. Take off the glasses. If you are not wearing glasses, get one. You have a beard, cut it off. Or if you have one, grow one. Or if you don't have one, grow one. Do everything you can without surgery. Live like that for 3 months. At least 3 months, 6 months. When you look at the mirror, see that change. Because after the surgeries, when you look at yourself on the mirror, you'll see someone completely different. This is not easy psychologically. I mean, 3 to 4 months. Live like that. If you can tolerate that, come and we perform this surgery. This is not easy. Patients take this matter so simple, just like in the movies. The face is taken off during the surgery and a new one is implemented. Just like that. They begin a new life. There's no such thing. On top of that, this doesn't end with the surgery. Let me tell you this. I'll go back to the surgery issue. The surgery is not only one part of this job. After the operation, the patient also needs to change their hair, beard, wear glasses or take them off. If he is bald, he needs to have hair transplantation or wear a wig. So many things are needed. So this is not over the surgery alone. To transform the complete appearance, hair color, shape of the beard, glasses, etc. These are also effective. They can even change the shape of their eyebrows. If all of these are done, then the patient can become unrecognizable. His or her type would drastically change. Other than that, there needs to be something to be done on the face. I'll not get into much detail now, but as I said, when a woman with a beautiful face comes to me, honestly, I couldn't find anything to do. I did not have the heart to make her ugly, so this is a difficult job and a tough call. If there are many things to do on a patient's face, that's great. Especially if there are problems to be fixed, that's more than perfect. If the face is extremely beautiful, then it's so hard. The patient should agree to it, to the fact that her face could become uglier and it will change, and it's difficult for someone to tolerate this and live with it. But what do our people do? They say, I'm bored, so I want to change my face. Don't come to me with such silly requests. It's not that easy. On top of that, there's a legal aspect to the job. When you make such an important change on a person's face, it is absolutely necessary to inform the judicial authorities. The patient's photo on the ID card must be changed as well. Maybe it's required to be in touch with the court. There are people who undergo this surgery with the court's permission. His or her ID is changed, the name is changed, and then you perform the surgery. A picture with that new appearance is taken to be used on the new ID. It happens. Do not underestimate this issue asking me, I'm bored, so I just felt like having this surgery. Also, like I mentioned, if you will recover these expenses of this operation, then you should have a very good budget. Such surgeries are very expensive. They also take a very long time. The patient's state of health must be well also, because such operations begin in the morning and end at the night. Let me roughly list the things to be done. We first take a picture of the patient. It is of course very important to have an examination at first. We roughly determine the things to be done during the examination, but we also work on the picture as well to number and list the operations to be performed. Where are we going to begin? Then which operation is to be done? We list and number. During the surgery, we hang the patient's picture on the wall with the numbers marked on it. All of them are performed one by one. Like I said before, if we begin in the morning, it ends at midnight. There are things that I don't want to give much detail about. What can I say? As I said, the patient's health condition needs to be very good, enough to hold under narcosis for a long time. The functions of the liver and kidneys should be good. There is not much to tell. Like I said, first of all, these are not surgeries one can easily tolerate. The patient must undergo trial period, changing and dyeing the hair, wearing the glasses, doing everything he or she can for like 3 to 6 months, living like that, and then consider whether or not to have this surgery. Second of all, like I mentioned, for legal purposes, any changes to the identity must be notified to official authorities. Also, there's the budget. You must have a solid budget. Unfortunately, this is the case. So I don't have much else to say. I don't want to go into details due to some aspects. From now on, I'll send the link of this video directly to the ones who ask me about this operation, so that you know. I don't want to have long conversation over the phone, because most people asking this are the ones thinking I'm bored, so I'll change my face, so whatever. See you.